I think about the importance of basic intrinsic health promotion. You know, the 7 pillars of health: diet, exercise, stress reduction, social support, sleep, whatever, finding meaning, traditional Chinese medicine, whatever else you want to add to that, which makes you a healthier person living with cancer, which means you are more able to be resilient in the face of whatever standard therapies you do, improves quality of life, and may well extend life or reduce the risk or delay recurrence. In other words, there's a whole series of things that anybody can do, right? Basic health promotion, becoming a healthier person living with cancer. So to me, that's the starting place. Now, do you take a different view for that, or is that?
No, and the one thing I would add to that is the importance of looking at etiologic factors in the genesis of whatever illness the person's working with, whether it's cancer or cardiovascular. And a lot of that has to do with toxicity, which you guys have been involved in, looking at for years here. What has our environment done to our genome? The genome is the, kind of the basic imprint that we're born with, but then there's the epigenetics, all of the factors that influence what happens in our genes, whether a gene's turned on or off because of the presence of, benzene in the environment, or chlorine, or plasticizers, that can interfere with normal hormone production. And so I think that, another important part of that has to do with getting, and this is something that conventional doctors are not addressing, but some kind of testing to look at what is somebody's toxic load. And there are various ways to do that. Some are very expensive and very elegant. Others are relatively inexpensive and still give good information. And a lot of that comes out of the field known as functional medicine. Are you all familiar with the term? People not familiar with functional medicine? Okay.
Let's say what functional medicine is.
So functional medicine is a term that was coined about 25 years ago that looks at analyzing somebody's health issues, not necessarily based on a specific Western medical diagnosis, but rather on what's not working properly in the body. For example, is there gastrointestinal dysfunction? Is there neurological dysfunction? Is there, are there inflammatory markers that suggest that somebody might be more prone to an autoimmune condition? And so it kind of backs away from the standard medical model of set of symptoms, physical exam, takes you to a specific diagnosis, which then takes you to a treatment algorithm. That's the way doctors practice medicine. And that's the way I did. That's the way I was trained initially. With functional medicine, I became more interested in looking at, well, let's do some stool testing and find out what the person's microbiome looks like. Do they have evidence of what we call leaky gut syndrome, where they're absorbing abnormal toxins from the gut into the bloodstream? What about a heavy metal analysis? Does this person have excessive amounts of mercury or lead or cadmium, all of which, can be big potential problems for downstream health issues. And a variety of other tests like that, which gives you a kind of a broader picture of how is this person relating to their environment, how is their body relating to the environment. And then there are specific treatments that have been developed that go along with those functional medicine analyses. So that's a big part of it, and integrative medical doctors do this for the most part. That's the functional medicine piece. And the integrative word means that they're usually combining the best of Western medical diagnosis and treatment with the functional medicine component as well.